Hello, today I'm going to be talking to you about the ethical dilemma of providers giving care to their friends. At some point during your career, you will likely be asked to provide medical care to a family member or give informal or undocumented care to a friend, neighbor, or colleague. Treatment for these individuals can range from refilling a prescription, discussing a recent injury, or ordering a test to even performing a major surgery. The ethical risks of caring for relatives or friends or providing informal or undocumented care are substantial, however, they are often overlooked. Although there may be limited situations in which providing care for a family member or friend is acceptable, these situations can be very hard to differentiate. According to the American Medical Association's Code of Medical Ethics, it states, physicians generally should not treat themselves or members of their immediate families. Unfortunately, this statement leaves some gray area because it doesn't directly state that healthcare providers should not treat their friends. So, what is a provider supposed to do if a friend is in need of medical care? Well, I'm here to tell you about some of the risks that could possibly be associated with providing care for a close friend. First of all, professional objectivity may be compromised when an immediate family member or friend is the provider's patient. This could result in the provider's personal feelings unduly influencing his medical judgment, thereby interfering with the care being delivered. Additionally, the provider may fail to probe sensitive areas while getting the patient's medical history, or fail to perform intimate parts of the physical exam due to a close relationship with the patient that makes this process uncomfortable. Similarly, patients may feel uncomfortable disclosing sensitive information or undergoing an intimate physical exam when the provider is an immediate family member or friend. Finally, there are concerns regarding patient autonomy and informed consent when providers attempt to treat someone with which they have an immediate relationship with. The patient may be reluctant to state their preference for another clinician or decline a recommendation for fear of offending the provider. Likewise, clinicians may feel obligated to provide care to immediate family members or close friends even if they feel uncomfortable providing this care. One study found that 99% of physicians reported loved ones' requests for medical advice, diagnosis, or treatment. Study findings determined that 15% of hospital physicians had served as the attending physician for a friend or family member, and 9% had performed elective surgery on a relative. With these risks in mind, it is ethically not appropriate for providers to give care to their friends, especially considering these individuals function very similarly to a family member. This means that they too are at risk for compromised provider objectivity that could result in poor delivery of care. To prevent objectivity and ensure the best care is provided, healthcare clinicians should advise their friends and relatives to seek care from another provider who does not have the emotional involvement and ties as you would likely possess. So yes, these issues are difficult, and the answers aren't always straightforward. However, the American Medical Association, along with other medical societies, has emphasized the ethical pitfalls in informal care and strongly advises against it. It is my hope today that you will think about these issues in the future, and if a friend ever comes and asks you for care, that you will think of the ethical pitfalls before providing this informal care. Thank you.